Hello, everyone. Good morning. Well, today we are going to be talking about a completely different topic. We are going to be talking about how functional medicine can help with thyroid problems. And joining me, it would be Dr. Anshul Gupta. Dr. Anshul Gupta is a former clinical Cleveland Clinic. I'm just adding him right now, and he will be joining. He's a functional medicine doctor now who's now on a mission to help people across the globe to improve their health. Doctor, there you
Hello,
are. Welcome, Dr. Gupta. How are you? Can you
I'm
hear
doing
me,
good. How are
Dr.
you
Gupta?
doing?
Yes, I'm great. I'm super excited to have you. I was just telling
Yeah,
our viewers that you are a functional medicine doctor who has specialized in thyroid and you're writing a book. So we would love to know, why should we do functional medicine for thyroid? What is the logic behind the functional medicine?
yeah, absolutely. So, just to kind of give you a little bit background on functional medicine.
Yeah.
Functional medicine is what I call is a root cause medicine. So, the conventional medicine is basically a lot of it is about symptom based. Like you
Mhm.
have a certain symptom, and that's the way we treat you with a particular medication or something like that. But we never go to the root cause of the problem of what actually is going on. So functional medicine, the way it functions is that we directly go to the root cause.
The root cause of the medicine, that's what you said, as opposed to the conventional medication, right?
That's correct, yes. So what happens is that, like especially in thyroid diseases, right, we do not know exactly why people develop thyroid disease in conventional medicine. So the
Hmm.
only treatment available right now is basically giving them thyroid hormones and nothing else.
I see.
But what we do in functional medicine is actually we dig deeper into
Yeah.
why
I
that person has thyroid disease. Like what is
Mhm.
going on with her body, so that we can basically help her out to reverse that.
Got it, got it. So when you talk about, no, that makes complete sense. I mean, otherwise it's like a pill society. I take a pill, and a pill is for everyone, right? My constitution would be different. So when you talk about the root causes, in your opinion, what have you discovered the root causes are for a thyroid disorder?
Yeah, so I kind of categorize them into broad five categories. So the
Okay.
first category is food. So we all have heard that food is medicine,
Yeah.
but unfortunately, if we do not eat the right amount of food or right kind of food, then
Hmm.
actually that food can harm our body.
I
So
see.
that's the first category, especially with the processed food that we have, which causes inflammation and
Hmm.
causes a lot of problems. So
Yeah.
that's that's a one big category that can lead to thyroid disorders. So
Hmm.
the most common food that I see which causes issues in that category is like gluten,
Okay.
dairy, processed food,
Hmm.
sugar,
Hmm.
all those things. The second big category in that situation is stress. So we are living in a very, very stressful environment these days,
Hmm.
and stress plays such an important role in regulating our hormonal health.
I
So
see.
stress can also precipitate. It's very common that
Yeah.
females will come to me and I said, when were you diagnosed with a thyroid disorder? And a lot of times nobody has asked them this question. So they
Mhm.
go back and they think, oh well, I had my first baby, and then just immediately after my delivery I got diagnosed with my thyroid.
Mhm.
Or I went through this like difficult divorce, and then
Mhm.
just a year later on I was diagnosed with thyroid. So it's
Yeah.
very, very common that stress can actually precipitate a thyroid issue.
Mhm. Mhm.
The third is nutritional insufficiency.
Mhm.
So what is happening is that our body needs certain amount of vitamins and minerals to make thyroid hormone.
Mhm.
And a lot of times, our diet is deficient or low on those vitamins and minerals.
I see.
And that's the reason, like a lot of times, we can develop thyroid disease. The fourth category is toxins. Now we are living in a toxic world.
Yeah.
More and more toxins are being poured in our environment each and every day. And we know that these toxins are harmful for our thyroid.
Mhm.
Whether it is pesticides or like, insecticides or like heavy metals like mercury or
Yeah.
like lead or like, mold toxins. All of those toxins can lead to hormonal dysfunction. And then the last category is infections. So different kind of viral infections or other infections can lead to issues with that.
I
So like Epstein-Barr virus is the most common infection. So that's what we see, that that can precipitate a thyroid disorder.
mm-hmm.
And then even actually we have one case study right now with COVID. Like a person was diagnosed with COVID infection, and later on she developed a thyroid disease. So
Okay.
we know that different kind of infections can also precipitate a thyroid disorder.
A
So
thyroid
those are
disorder.
the big five categories that I can say are the root causes. As I
Okay.
said, the food is one, which is a processed food. The
Yeah.
second one is stress. The third
Yeah.
is nutritional deficiencies.
Yeah.
The fourth is toxins, and the fifth is infections.
Infection. So someone is making a comment about the hair loss. I don't want to ignore the comments that are coming. So yeah, I know it's deviating a little bit what we are talking, but is hair loss sort of like a byproduct of having a thyroid? Is that there?
That is correct. Yeah. So thyroid hormone is important for a lot of different functions in our body.
Yeah.
And hair growth is very, very important. And
Okay.
thyroid hormone does affect, like hair growth. So
I
it is
see.
very, very common that, when people have thyroid disease,
Mm-hmm.
that, they have poor hair growth, or they start losing their hair, or they start seeing the thinning of their hair. So
I
very,
see.
very common symptom that I see.
Okay, so hope we answered that question because someone asked this question. Now let's talk about, we know the root causes. So the test, functional medicine does test, right, to determine. So just tell us what are the different tests that you're doing to determine what the issues are, like you talked about the nutritional deficiency, stress. How do you figure out the stress levels and different tests that you do?
Yeah, so first let's talk about, like thyroid testing itself.
Okay,
So because, like most of the conventional doctors, like do not check the thyroid in detail. And
I
that's
see.
where functional medicine doctors are a little bit different, because we check thyroid in much more in detail.
Okay.
So if you go to a typical doctor, the only blood work that you will get is basically a single
Yeah.
blood work, which is called TSH.
Yes.
Okay.
And we've heard about
But
TSH
in
levels.
functional
Yes. Yes.
Yeah, so but in functional medicine, we not only check TSH, we check other things. So we check other thyroid hormones like T3, like T4. There is something called reverse T3. And then we also check thyroid antibodies, because the most common reason of thyroid disease currently is
Mm-hmm.
Hashimoto's. Okay, and for that, we need to check those antibodies, which are like TPO, which is a thyroid peroxidase antibody. And
Mm-hmm.
then the other antibody that we have is called thyroglobulin antibody.
Okay.
So all those blood work needs to be done, even for basic evaluating the thyroid in complete detail.
And what about the metal, the toxins? Do you also check for heavy metal tests or toxins in the body, or?
Yes, so yes, we can check heavy metals and toxins. There are different ways of doing it. The most
Okay,
common way is checking blood levels of those heavy metals.
I
But the
see.
blood levels might not reflect the accurate, measure of toxins or heavy metals in your system. So that's the reason, the functional medicine has a very, very specialized testing of heavy metals, which is through urine. So we
Okay,
check those heavy metals in the urine, and that actually gives us, the complete picture of how much body burden of those heavy metals are there in the system.
got it, got it. So blood test and blood test and urine test, and looking for additional parameters as opposed to only looking at the TSH levels. That's right. Okay. So,
Yeah.
so all right. So let's talk a little bit about, once we know the root cause, once you got the testing done. So on a very high level, what are your key principles for treatment? You're not giving the medication as we talked about earlier. Like
Mhm.
so. What are the key high level principles of your treatment level?
So the first thing what we do is that, like we start them on a special diet. So what I have developed is a special diet, which is called a mitothyroid diet.
Okay.
Okay. So the
Okay.
principles of the diet are based on to help people with thyroid disorders to reverse their thyroid disease. So in that diet, first of all, we remove food which is destroying people's thyroid gland.
Yeah.
And then after that, we introduce food which supports the thyroid.
Okay.
So the top foods which kind of harms the thyroid gland, as I already mentioned, is like gluten, dairy, soy, corn, sugar, processed food, processed meat, all of those things go out of the picture, in that diet. And then we start introducing foods which heal the thyroid, which, are like your green leafy vegetables, other colorful vegetables. So those
Mhm.
are important. And then we have good sources of protein.
Okay.
So clean protein is what I call them. So the
Mhm.
clean protein, if you're a vegetarian, like which could be, like your seeds, like sunflower seeds, pumpkin seeds, chia seeds, all of
Okay.
those can be one. Then, we always have our uh, like meats, which, again, chicken, fish, and turkey are good sources of, like proteins. And
Okay.
I'm a big fan of actually smoothies. So all
Oh,
of my patients start their day with a smoothie. And
okay.
generally, you can, again, I recommend getting a very good plant-based protein powder, and
Okay.
then just add all the good stuff in it, and that takes care of the protein, like in during the day. And then I'm also for thyroid and for thyroid functioning, we also need good fats. So
Mm-hmm.
that's the reason a lot of my patients will eat a lot of nuts and seeds, and
Mm-hmm.
then we'll have good fat like olive oil, and
Mm-hmm.
then ghee, which is, like the
Hmm.
Indian clarified butter. So
Yeah.
ghee is also very nice.
Mm-hmm.
Um, so all of those things, we kind of help them to do that. Coconut oil or coconuts, and nuts like almonds, walnuts,
Hmm.
pecans, all those things, we have a lot of those in our diets.
Great, great. So, what about the stress? Do you also prescribe? Doctor is prescribing meditation. This is amazing. This is the world we all want to live in. But do you also prescribe yoga, meditation, some of the other things that help you relieve the stress as well?
Absolutely, yes. So I'm a big believer in meditation. I myself practice a form of meditation which is called heartfulness. So, like
Okay.
how we have mindfulness, and this is
Mhm.
heartfulness. So, this is
Okay.
a heart-based meditation, very very effective and very easy to do. But
Mhm.
anyways, yes, all of my patients, which I see, go through some or the other kind of de-stressing exercises, which can be meditation, which can be yoga, which can be deep breathing,
Mhm.
all of those things, and I help them out to kind of figure out what is the best method for them.
So basically, diet and proper diet, and also prescribing yoga, meditation, some of these de-stressing techniques, I should say that.
Mhm.
These two things, anything else, or these two things are enough, I think, to start the reversal process, right?
Yeah, so other two things that I recommend obviously is going after toxins, because almost 90% of my clients that I see who have thyroid disease have issues in toxins. So they go through a detox protocol, and then
Okay.
the last thing they also do is that they go on some supplements to support their thyroid.
I see. So what are the so that brings us to the next question, common supplements, and this is not a medical advice, guys. I know you guys are watching this, but this is not a medical advice. I want to say that these are free educational sessions we bring. So common supplements, if you don't mind, please.
Absolutely. Yeah. So common supplements which most people can use, first of all is vitamin D. So
Okay.
vitamin D is such an important vitamin, or supplement which supports the thyroid gland in all different ways. So the good part is that there is easily test available to check the vitamin D levels. So if you do have thyroid, I always recommend everybody to get their vitamin D levels checked. And if they are in the low side or in the low normal side, then they should all go on vitamin D supplement. So
Okay.
that's first thing. The second supplement, which is very very helpful for thyroid issues, is selenium. So
Hmm.
selenium is another mineral which is important or needed for proper production of thyroid hormone. And also it reduces autoimmunity. So like in Hashimoto's disease, which is an autoimmune thyroid disease, it has shown to reduce the antibody levels. The third supplement, which is very, very useful, is zinc. So zinc actually is responsible for producing of thyroid hormone, but is also responsible for converting the inactive thyroid hormone to active thyroid hormone. So
Wow.
again, very, very important supplement that is important for everybody on that front.
Mhm.
And then the fourth supplement, which again most people will need, is vitamin B12.
I
So
see.
it's very, very common that I see that vitamin B12 is low in a lot of people who have thyroid disease. So that's another fourth supplement that a lot of patients or clients of mine go on that supplement also.
That's amazing. That's amazing. Someone made a comment that her or his mom has thyroid. I want to make a observation. I should say that that I was looking at the data, and then more women seem to have thyroid problem than men, and which is I thought the men are more stressed out than women, you know. So this from a statistic point of view, it's the other way around. I don't know why, but any comments from you on this observation?
Yeah, so it's actually, it's not just an observation, it's a fact. So we
Yes.
know that, like 90% of the thyroid patients are actually women, which are middle-aged women.
Yeah.
Anywhere from starting to 30 to 60, you will
Okay.
see like, majority of the women, can have thyroid disease.
Mm-hmm.
So we still exactly do not know the reason for it,
Mm-hmm.
but, the thought process is that, women, because of their very, very fragile hormonal like balances, because they
Mm-hmm.
have their own female hormones and then
Yeah.
they have the thyroid hormone. So because of the imbalance between those hormones, they
Mm-hmm.
are more susceptible to these autoimmune conditions or thyroid conditions. So that's what happens, because these toxins and stress and all those things are very, very dangerous, you can say, for all the different hormones, especially the female hormones. So they create inflammation, and that's the reason the people develop thyroid disease. And that's exactly the reason, like the females are more susceptible to it as compared to the
Mm-hmm.
males.
So you think it also has to do with the menopausal that's hitting? I mean, that's probably one. You know, it contributes to the overall thyroid. Was someone's marked a comment saying amazing? Yeah, that's really very amazing what you said. But maybe the menopausal part also contributes to thyroid issues. You
Yes.
think they?
So again, like how I mentioned that, whenever somebody is diagnosed with a thyroid disease, I always ask them to go back or what
Yeah,
changes they had in their life. And it is so
that's
amazing
right.
that, I can always ask them and kind of see that they either had a menopause or something and suddenly they
Yeah,
were diagnosed with a thyroid condition. So there is a
yeah.
very, very strong connection between all different kind of thyroid hormones as well as with
Okay,
the female hormones. So yes,
got it.
like menopause can be a trigger which can cause a lot of people to have thyroid issues.
Got it. Got it. That's an amazing session, Dr. Gupta. It's really amazing, all the information that you've given in a small 15-minute box. I think it's amazing. Anything else you'd like to add before we wrap up?
Yeah, so I always say that, like people do not have to suffer because of thyroid. So,
Yeah,
like there is a way out, because a lot of people with thyroid that come to see me, they have been suffering from these symptoms for several years, like hair loss, like fatigue,
yeah,
like brain fog, like
yeah,
constipation or gut issues, not feeling good, or weight issues, very, very major issues. And they have
yeah,
been told that nothing can be done because
yeah.
they are all taking medication but still continue to suffer. And I always tell my clients or patients is that, well, you do not have to suffer. There is a way
Yeah.
out of this. And almost all of my clients are able to achieve their health goals or are able to reverse a lot of these symptoms. So you just
Yeah.
need to know what to do, and there is a possibility out there.
That's amazing. And we will be bringing these wellness programs in January. So with Dr. Gupta. So and any other comment anyone has, you're welcome to put it in the chat window. You know, I see people are putting all kind of different things. But you can also email us or direct message us. Welcome for your feedback. We'd like to wrap up this session now, and thank you so much, Dr. Gupta, for joining us. And we will be coming up with new sessions with Dr. Gupta in future. Thank you so much, Dr. Gupta.
Yeah, thank you so much for having me, on your live session. It was really, what you guys are doing is amazing, bringing so much information and knowledge. And I'm definitely excited for, bringing like a wellness program for thyroid clients for you for next year. I think I'm very excited about that.
Great, great. Thank you. Yeah, we just want the information, the right information to flow to all the people. That's our goal. And I think both of us have the same goal. With that, thank you so much. Bye-bye
Yeah.
now.
Yeah. Thank you so much. Thank you. Bye bye. Take care. Have a
Bye-bye.
nice day.
Thank you.